Hello. Okay, so after a long time, we're going to discuss about the surgical site infection today. You have the FMG exam very close to you, so hope you are preparing well. Okay, let's see one question over here. What is the most common nosocomial infection? Right, they have multiple options like UTI, surgical site infection, skin and soft tissue infection, respiratory tract infection. So here this is a question, what is the most common nosocomial infection? Nosocomial infection means the hospital acquired infection. Hospital acquired infection, right? And it should be defined, the infection appear after 48 hours of hospital admission. Is that okay? This is defined as what? The nosocomial infection. That means after the patient's admission, the infection should appear after 48 hours. If it is before 48 hours, that infection is not the hospital acquired. Probably patient has carried the infection earlier, but because of the incubation period, symptom was not visible, right? So among these, the most common nosocomial infection usually is the UTI, right? Urinary tract infection is the most common nosocomial infection. This is a question in the exam. Please be careful in your coming FMG exam. And they will ask you what is the most common organism causing the nosocomial infection. The organism is Staphylococcus aureus. So please remember, this is another question in the exam. Is that okay? And here we have the surgical site infection. Surgical site infection is the most common health care associated infection. Is that okay? This is another question in the exam. So if they ask you in the exam what is the most common healthcare associated infection, the answer should be surgical site infection. And if they ask you the question like what is the most common nosocomial infection, your answer should be what? The UTI. Is that okay? Hope you understand. Let's go forward. Let's do some of the definitions that you know already, but let's revise for the newcomers. What is wound? Wound means what? Break in continuity of the external lining, that means the skin, or maybe the tissue, internal organs, right? That is called what? The wound. And here the structure and function will be disturbed. Is that okay? Will be disturbed. Is that clear? And ulcer means what? It's a smaller than wound. It's just a breach in the skin or mucosa, or maybe the tissue capsules. Tissue capsules. It is smaller than the ulcer, but this is all, sorry, smaller than the wound, but this is also a type of wound. And here usually the cause is internal causes, for example ischemia or maybe the neuropathy. Hope you understand, right? And here the structure and the function usually remain intact. Hope you understand. And what is surgery? Surgery means it is the process of gaining access to the deeper tissues. Here we use either the diathermy instrument, or we use the scalpel means the knife we use, right? So after gaining the access, we go into the deeper tissues. That is called what? The surgery. After surgery we do the procedure, right? Procedure. After procedure we close the wound, and that wound after closure is called what? The surgical wound. Is that okay? And infection of the surgical wound is called what? The surgical site infection. So what is surgical site infection? Let me clean this one. Surgical site infection is, this is the infection of surgical wound, right? And this surgical site infection usually occurs within 30 days, right? Within 30 days if there is no prosthesis, and it may occurs up to 90 days if there is prosthesis. Prosthesis means, for example, you have the compound fracture and you use the plates or rods, or probably you have the the heart valve replacement, right? So if this kind of prosthesis you use, then the infection may occur up to 90 days, right? So if it is not used, then the infection usually occurs up to 30 days, right? So this is the common infection days, the timing. But even by saying so, there may be the question like what is the most common, right? the timing of the surgical site infection, then the answer should be within 4 to 30 days, right? So most commonly it occurs within 4 to 30 days. This is the most common timing for surgical site infection. Is that okay? So hope you understand. And the another point here we have to understand is that the surgical site infection is the most common health care associated infection, right? And here we have to say about 16% of the healthcare associated infection is made by the surgical site infection. So surgical site infection makes about 16% of the healthcare associated infection. This is the most common healthcare associated infection. This is another question in the exam. Next point you have to remember is that about 5% of the surgical patient, they develop the surgical site infection. How many percentage? 5%. This is also another question in the exam, right? So hope you understand these many things, right? Say, and among these, right, the infections, the most common surgical site infection is produced during the GI surgery. About 10% of the patients with GI surgery develops the surgical site infection, and the least common surgical site infection is produced during the orthopedic procedures, right? So orthopedic procedure produces less than 1% of the surgical site infection, right? So hope you understand this much. Yes or no? Another point you have to understand here, what is the most common organism for the the surgical site infection? The most common organism is the gram positive organism. Is that okay? This is most common, and these organisms are usually the skin flora, because once we do the surgery we make the incision, and then these organisms they enter into the wound through the incision site. Is that okay? And then least common organisms are the gram negative, right? And these gram negative organisms, if they usually involve after the GI surgery. Is that okay? GI surgery or bowel surgery. Hope you understand, right? And another point we have to understand over here is that if the infection produced within 24 hours, healthcare associated infection, if it produced within 24 hours, we have to understand the organism is usually the Clostridium or Streptococcus. What is this one? Clostridium or Streptococcus. Is that okay? If the infection produced within 24 hours, we should understand the organism is what? Clostridium or Streptococcus. If the infection is produced after 48 hours or in 5 days, we should understand the organism is gram negative. Hope you understand, right? So these are the points they will ask you in the exam. And by the surgical site infection, it increases the length of hospital stay by 7 to 8 days. That means patients should stay to the hospital for more 7 to 8 days if they develop the surgical site infection. So if you understand, another point here we have is that the major surgical site infection. How do we define the major surgical site infections? Here we have to care about the 2 points. Either we will see the significant pus discharge from the wound, right? This is the one criteria. Another criteria, the wound should be reopened to drain. Even there is less pus discharge, but that less pus discharge also cannot be cleaned without cutting or removing the suture materials. Then if we reopen the wound due to the infection, or even without opening there is a significant pus discharge from the wound, this kind of infection is called what? A major surgical site infection. Hope you understand. This is also the question in the exam, right? And here we have the classification of the surgical site infection. So let's see the classification. We classify the surgical site infection into 2 ways, like the incisional surgical site infection or organ space surgical site infection. Is that okay? Or organ space infections, right? So incisional surgical site infections we divide into 2 categories, that is superficial incisional surgical site infection or deep incisional surgical site infection. So hope you understand, right? So superficial incisional surgical site infection, it involves the skin plus subcutaneous tissue, right? Skin plus subcutaneous tissue. If this two is involved, then we say what? Superficial incisional surgical site infection. If it is the deep incisional surgical site infections, they involve the skin, they may involve the fascia, or they may not involve this. They directly involve what? Sorry, the skin, and they involve the subcutaneous tissue, or they may not involve, and they may involve directly to the fascia and muscles, right? If they involve the muscles and fascia directly, or they involve the fascia and muscles with the skin and subcutaneous tissues, then we say this is what? Deep incisional surgical site infections. Hope you understand. Right, so you can see here, deep incisional, it involves the deeper tissues like fascia and muscles, right? They may or may not involve the skin and subcutaneous tissues. Oh, clear? And organ infections means they may involve the organ, or they may involve the spaces in the body. Spaces means, for example, peritoneal space produces the peritonitis, maybe the pericardial space produces the pericarditis, maybe the pleural space produces the pleuritis, maybe the meningeal space produces the meningitis, right? Or they may involve the organs, right? They may involve the organs, like you may have the bowel, they involve directly bowel gangrene, right? Or may they involve the the enteritis. Similarly, they may involve the pancreas, pancreatitis, right? They may involve the liver, may produce the hepatitis, may involve the the myocardium, right? So this kind of the organs specific involvement, or the body space involvement, this can be the another type of what? The surgical site infection. So surgical site infections we divide into two categories, please remember. That is what? Incisional surgical site infection. Another one is the organ space infections, right? So incisional surgical site infections are of two types, that is superficial incisional and deep incisional. Superficial incisional involves the skin and then the subcutaneous tissues. The deep incisional, it involves the fascia and the muscles plus minus skin and subcutaneous tissues. Hope you understand, right? And organ space means either the deeper organs or the spaces of the body they involve. Hope you understand, right? So here we have the same classifications. SSI has incisional and then the organal space, right? Incisional has superficial and deeper. Organal space has multiple infections, right? Arterial, venous, breast abscess, mastitis, endocarditis, right? Intra-abdominal infections and abscesses, right? So these multiple, and similarly osteomyelitis as well, right? So these are the organal spaces. What's the pathophysiology and risk factors? Look at here. We have the triad of the surgical site infection, right? So what are the triad? We have the insult, we have the bacterial factors, we have the host defense factors, right? So let's see the host defense factors or the systems. For example, we have the physical barriers, example the skin or the mucosa. This skin or mucosa, we have the lots of normal floras. So number one, these flora present within the the skin or mucosa, they do not allow the opportunistic infections or the foreign the organisms to invade. Number one. Number two, these skin or mucous membrane, they themselves act as the barrier, right? So that the organisms or pathogens, they cannot enter easily, right? So to enter inside to the body tissues, they should penetrate the skin or the mucous membrane. So during the surgery, we break the physical barriers, right? So that can be the host defense weakens, right? Similarly, we may have the chemical barriers. For example, we have the HCl in the stomach, right? That may be 1.5 to 3.5 pS, which is highly acidic. So anything else which enters from our GI tract through the esophagus, they will be killed by the the HCl in the stomach. But during the surgery, what happens? We give the what is this one? The PPIs, right, to prevent the acid reflux to the patients, and that may decrease the that may increase the stomach pH and decrease the acidity. When the acidity is decreased, then that time the pathogens, they may survive, right? So that this is another point. Another point is that antagonism by the commensals. Yes, just now we discussed, we have the normal flora. These normal flora within the skin or the mucous membrane, they antagonize the pathogens. Similarly, antibacterial substances, for example, we have some antibacterial substances in our tear or in the milk, like the lysozymes, or in the milk we have the lactoferrin, right? lactoferrin. So these are the the antibacterial substances which are produced in our body, like lysozymes or lactoferrins. They kills the bacteria. Yes or no? So during the surgery, we are the anesthetized so that we do not produce this kind of substances. Similarly, the immune state of the patients, like immune state, some patients may are immunocompromised in a sense, like they may be suffering from the diabetes mellitus. They may have the the AIDS, right, acquired immune deficiency syndrome. Or they may be taking the chemotherapy, right, they may be taking the radiotherapy, or they may be under the steroid, right, steroid therapy, right. These things, they causes the opportunity to the infections by the pathogens. Similarly, we have the immune systems, like the acquired immunity or the innate immunity. In this, we have the humoral immunity, or we have the cellular immunity, right. Humoral immunity may be the antibodies, right, or we may have the the opsonins. What are those opsonins in our body? This is the question in the exam. IgG, IgM, right? So these are the opsonins in our body. Similarly, we have the the C3b complement factor, right? C4b complement factors, right? So these are the opsonins in our body. So these opsonins, they helps in the phagocytosis. They enhance the phagocytosis rate, so that our immunity remains stronger. Similarly, the cellular defense we have, right? So the cellular defense, like we have the neutrophils, we have the macrophages, we have the the all the phagocytic cells, like the lymphocytes, yes and no, right? So these are the immune system. So anyway, these host defense, or these host defense, when they becomes weaker during the surgery, the chances of infections increases. Is that okay? And what are the other factors? So like the insult during the surgery, we may have the insult, like the foreign body trauma, or even after the surgery, closing the surgical wound, we use the suture materials. We use what? Suture materials. And in the suture materials, we use the silk suture, right? So the silk suture increases the rate of infections. Rate of infections. That's why we should not use the usually the silk suture to they close the superficial wound. Similarly, foreign body, if yes, just now we discussed foreign body. Necrosis, if there is a necrotic tissues, they increases the chances of infections. Similarly, the ischemia, to say ischemia, we have to say one fact, like if there is less than 10 gram per the per deciliter of the blood hemoglobin we have, right, then what happens, the wound healing will be delayed. If the wound healing delayed, then the chances of infections will increase. Similarly, hematoma can be the potential site for bacterial infections, right? Hematoma means the collection of the blood within the tissue. So that these are the factors during the surgery. We create all of these favorable conditions to develop the the infection. Similarly, bacterial factors also we have to see, like the virulence. Some of the bacteria, they need less number of bacteria to causes the infection. Some of the bacteria or pathogens, they need less number of the pathogens to create the infections, right? So that virulence means we have the the definition over here: quantitative ability of an agent to cause disease. Like some less number can cause the disease, some need more number to cause the disease, right? So it depends on the the pathogenicity, how harmful are they. Similarly, inoculum means, let's say the entry. During the surgery, we incise the skin, we break the physical barriers, and then we cause the entry of the pathogens inside. That we can say as an inoculum, right? Similarly, the growth rate, some of the pathogens growth rate is very high, some of the pathogens growth rate is very slow. According to the rate of the growth, they can cause the infections, right? So this we have to understand. Another point I have to explain over here, right? Usually surgical site infection is missed. Why missed? Because we said the most common the timing is 4 to 30 days, we say, yes or no? So usually we discharge the patient before 4 days, because of the the patient's factors also, we are forced to discharge them earlier, because the money matters, the patient's business matters, right? So many things else, timing, so that we are forced to discharge the patients earlier. So when we discharge the patients earlier, we usually miss the surgical site infections. Let's see classification of the surgical wound. We have some classification of surgical wound. We classify this, we did already during the wound classifications, but here again we revise. Like clean wound, we have clean contaminated wound, and then the dirty wound, right? Four types of surgical site, the surgical wounds we have. So what is clean wound? Clean wound means the all the surgeries we do in the aseptic condition. Aseptic surgeries, all the aseptic surgeries. That means when the patient is in the OT table, we clean the skin thoroughly, and then we start the surgery, right? So all of these aseptic surgeries, they are the clean wound, right? So that there will be no break in the surgical asepsis, and then there will be no entry into the respiratory, gastrointestinal, and urogenital systems. That means we do not touch these systems. That means we are not performing these surgeries. Is that clear? So that this is called what? Clean wound. And this clean wound has surgical site infection rate about 1 to 2%, with or without prophylaxis. With or without prophylaxis, so that it does not need, no need of prophylactic treatment. Is that okay? What is prophylactic treatment? Prophylactic treatment means we give the antibiotics IV, at the time of anesthesia induction or within 30 minutes of surgical procedures. That means 30 minutes before the starting of the surgical procedures. Is that clear? This is called the prophylactic antibiotics. So hope you understand about the clean wound. And what are the examples of the clean wound? We said all the aseptic surgical incisions, right? So here also we have to understand some more things, like the orthopedic procedures, like the joint replacement procedures, right? Similarly, cardiovascular system procedures, right? Similarly, the nervous system procedures, and the organ removals like ectomy, for example, thyroidectomy and mastectomy. These are the examples of the clean wound. Please remember for exam, right? So these are the questions. Similarly, clean contaminated wound. Clean contaminated wound means we do not enter into the the GI system, respiratory system, or the urogenital system. We do not enter knowingly, but unknowingly we break them. We break them, right? That means maybe catheterization or something else this way, right? So that means we have to say we enter or we touch these three systems: GI, GU, and the respiratory system. We touch them, right? So we break on them so that the contamination may occur. First point. Second point, maybe we started the surgical procedure with the aseptic conditions, but because of any reason there may be the contaminations by the health workers or by the instrument, something else, right? So this is minor contaminations. Hope you understand, right? Similarly, we have sometimes the aseptic cut, for example, like the knife cut, right? But usually this knife cut and all the traumatic wounds should be kept under the contaminated wound, right? So that better not to say knife cut in these conditions, right? So here in this condition we start with the asepsis, but there is a contamination, so there is a break in the GI, GU, and then what, the respiratory tract. Is that okay? So in these conditions we say this is what, the clean contaminated wound, right? So examples of this clean contaminated wound you have to understand. So they may ask you in the exam, right? So that is the hepatopancreatic surgery, hepatopancreatic surgery. All of this hepatopancreatic surgery we keep under what, the clean contaminated wound. Example also you can remember as the cholecystectomy. Hope you understand, right? So these are what, the clean contaminated wound. Also the elective, the appendectomy, that is also what, the clean contaminated wound. And contaminated wound we have here. Contaminated wound means we start to do the procedures in the septic conditions. Septic condition procedures means, for example, all the traumatic wound which present before 6 hours. Is that okay? If they present after 6 hours, they become dirty wound. If they present less than 6 hours, all the traumatic wound, they are called what? Contaminated wound. And here we can also say the knife cut. Knife cut. Is that okay? We are cutting the vegetables or the fruits. We are not, sterilize the skin. Of course, we do not sterilize, right? So while cutting, the fruits or the vegetables, or while handling the knife instruments, we make a cut. That is called what? The contaminated wound. And here we may have the foreign bodies present in the wound, right? In these conditions, right? So these are called what? Contaminated wound. An example of the contaminated wound you can remember, like we during the surgery there may be the spill from the GI, GU, or respiratory tract. And here we can say elective GI surgeries. All the elective GI surgeries are under what? Contaminated wound, because intestine are the major, the site of floras, right? One point I missed to explain to you: our human body has about 10 to the power 14 pathogens in our body, right, as a normal flora. So see how huge number of pathogens we have in our body. So they may contaminate. And for the details, you can see the wound classifications. We have these all details, right? So dirty wound we have. Now the dirty wound means any wound, traumatic wound, right, which is present after 6 hours. First point. Another point, yes, of course, we enter into the respiratory, gastrointestinal, and urogenital tract, right? And there is a gross presence of foreign bodies, or necrotic tissues present over there. Is that okay? Right? So in these conditions, and we have the diverticular perforations. Perforation. Is that okay? So these conditions, or there is a presence of frank pus or frank abscess present over there. So these all kind of wounds are called what? The dirty wound. And some points I missed over here to explain, like here SSI rate is how much? Clean contaminated wound. Okay, let's mention over here SSI rate is 1 to 2%, right? So prophylaxis, no need. Clean contaminated wound, we have the SSI rate about how much? SSI rate is we have about 10 to 15% SSI rate, that is without prophylaxis, right? But if we give the prophylaxis, this contamination, this SSI rate becomes less than 10%. Is that okay? And this contamination, the SSI rate is maximum at at the the GI surgery. About in the GI surgery, this SSI rate is about 30%, and if it is biliary surgery, it is about 20%. So GI surgery, it is about 30%, and if it is biliary surgery, it is about 20%, right, in the clean contaminated wound. And the contaminated wound, here we need the prophylaxis. Contaminated wound, we have the surgical site infection rate. Please remember, this is the question in the exam. Okay, this is about how much? 15 to 20%. This is surgical site infection rate with the prophylaxis. But if we do not give prophylaxis, this may go up to 60% without prophylaxis. So that we need the prophylaxis over here. And dirty wound, we have the surgical site infection rate. This is about 40% with prophylaxis, and without prophylaxis it is more than 60%. So here we need the prophylaxis plus treatment. Hope you understand, right? So these are the questions in the exam. Now, what are the source of the infections? So in the source of infections, we have the primary source and then the secondary source. Primary source, already, this is our normal skin flora, or GI flora, right? So this is the most common source of infection, surgical site infection, that is the skin flora, right? Because we already discussed, we have 10 to the power 14 number of organisms in our body, right? So this we have to understand. And this primary source we already discussed, like if it is within less than 24 hours, if it is the surgical site infection, healthcare associated infection, we should understand this is what? Either the Clostridium or this is Streptococcus, right? So we should understand this one. And another examples of these the pathogens we have to remember here is that beta hemolytic streptococcus, they causes cellulitis. Beta hemolytic streptococcus, they causes what? Cellulitis. right? You should understand. And the Streptococcus pyogenes or fecalis, they are commonly involved after the large bowel surgery. Streptococcus fecalis or Streptococcus pyogenes, they involve after the large bowel surgery. Please remember, question in the exam, is that okay? Another point to remember here is that okay, Clostridium perfringens, right? Most common for the gas gangrene, is that okay? Please remember this one. And we have another one is Clostridium difficile. This is most common for the pseudomembranous colitis. I may miss some points, that's why I'm just taking the reference, right? And you have the Clostridium tetani. Yes, you know this one, right? Clostridium tetani, that means it causes what? Tetanus. Hope you understand, right? And similarly, if it is the Staphylococcus, they usually cause the catheter and prosthesis infections, right? If it is the Staphylococcus, usually aureus, right? Staphylococcus aureus, catheter infections, or maybe the prosthesis infections, most common organism. Question in the exam, please remember. Question. Okay, these are the most common organisms involving wedding. And bacteroids usually involve after the GI or GU surgery, most common organism involving. Okay, and then another point is what? The pseudomonas, they are most common after burn, is that okay? Burn wound infections. So please remember, these are the questions in the exam. And another source is what? The secondary or exogenous source. Secondary or exogenous source may be from the the surgeon, or the OT staff hand, right? Or maybe the ward infections, or maybe what is this one, the OT, operation theater infections, contaminations, right? So that is the secondary source or exogenous source of the surgical site infections. And these are the normal floras of our body. We have, if you are interested, you can see nose and throat, mouth and teeth, skin and scalp, perineum, lungs, stomach, small intestine, large intestine, urethra and vagina, right? Sometimes they can ask you a question from here. Okay, what are the common the normal flora in this region? Okay, and what are the presentations? These presentations we divide into the localized presentations, specific presentation, and systemic presentation. So let's do it very fast. Okay, so in the localized presentations we have something like that we know already. Localized, it presents the cellulitis or lymphangitis within 3 to 5 days. Cellulitis or lymphangitis, it presents within 3 to 5 days. Remember, question in the exam. If it is the abscess and pus discharge, it develops in 7 to 10 days. So remember, these are the questions in the exam, right? And in this localized presentation we will see what? The superficial. If we see superficial incisional surgical site infection, superficial incisional surgical site infections, right? To say superficial incisional surgical site infections, it should be present within 30 days of the procedures, first point. Plus, it should present with any one of the following, like it should be either pus positive, or it should be with the organism positive in the culture or something else, right? Or there should be the sign of inflammation like erythema, or maybe there should be the tenderness, right? Or there should be the pain. Is that okay? So that to say the superficial incisional surgical site infection, there should be few points present. Number one, it should present within 30 days of the procedure. Another one, any one of the following, like maybe pus positive, maybe organism positive in the lab procedures, or maybe erythema, tenderness or pain. That means inflammatory sign should be positive. Then we say this is what? The localized presentations, right? Or localized surgical site infection. Similarly, to say the deep surgical site infection, it may present with what? The deep surgical site infection also. Deep incisional surgical site infection, right? So to say this one also, it should be within 30 days or 90 days if prosthesis used, right? Without prosthesis, presentation should be within 30 days. With prosthesis, the presentation should be within 90 days, right? So this one point, plus it should also contain any one of this one. For example, there should be, the what is this one, pus or dehiscence. There should be pus positive or wound dehiscence, right? Wound dehiscence means the suture, where we apply the suture in the wound, that suture should be decayed, right? Suture should open, the wound should open, that is called the wound dehiscence, right? The closed wound, if it is opened by the suture material phagocytosed by the bacteria or something else, then the wound will open, that is called what? The wound dehiscence, right? So either pus should be positive or dehiscence should be positive, or there should be organism positive, right? Organism positive, then we say this is what? Deep incisional surgical site infection. So hope you understand this one. And specific presentation, these specific presentations may be like, there may be the gangrene present, right? Or maybe there is the necrotizing fasciitis present, that is the specific presentations. Is that okay? Right? And if there is the organ space presentation, already, we discussed already, right? There may be the pleuritis, pericarditis, peritonitis, or meningitis. This kind of presentation should be there, or maybe mastitis, right? This kind of presentation should be there. Another one, now let's go to the systemic presentation. Systemic presentation can be SIRS. What is SIRS? Systemic inflammatory response syndrome. That means due to the inflammation, we have the inflammatory mediators, they goes throughout the body, and these inflammatory mediators causes some changes in the body. So what are the criteria of the SIRS? In this case, heart rate more than 90, respiratory rate more than 20, right? Similarly, we have the temperature either more than 100 or less than 96 degree Fahrenheit temperature, and we have the WBC count either more than 12,000 or less than 4,000, right? And we have the PCO2, that should be less than 32 mm of Hg, right? So what are the criteria for the SIRS? Remember, this is very important question in the exam. SIRS criteria, right? Systemic inflammatory response syndrome, that is heart rate more than 90, respiratory rate more than 20, temperature more than 100 or less than 96, WBC more than 12,000 or less than 4,000, PCO2 less than 32 mmHg, right? Any two more or equal to two of these criteria, if it is present, then we say this is what? SIRS, systemic inflammatory response syndrome. So patient with surgical site infection may present with SIRS. Patient may present with the sepsis. Sepsis means what? SIRS plus there should be the infection present, right? So SIRS is only inflammatory response. There may not be the infection present. Is that okay? So if SIRS comes to you with the infection, the proven infection, then we say what? Proven or suspected infection, then we say this is what? Sepsis, right? Severe sepsis means patient has the sepsis plus any one organ failure symptoms. For example, systemic blood pressure less than 90 mm of Hg. Is that okay? Then we say this is what? The severe sepsis. Then we'll go to the septic shock, right? To say the septic shock, there should be the severe sepsis, right? There should be the severe sepsis plus persistent organ failure. Example, to maintain, usually we see to maintain the systolic blood pressure, or we can say mean arterial pressure more than 65 mmHg, we use the vasopressor support, right? In case of severe sepsis, this can be maintained by the fluid therapy, but in case of septic shock, This fluid therapy cannot maintain the mean arterial pressure more than 65 mmHg, and we need what? The vasopressor support. Is that okay? And both of these should present for at least 24 hours. Is that okay? Right? So this condition should be what? Severe sepsis or septic shock. Hope you understand, right? After that, MODS, multiple organ dysfunction syndrome. Multiple organ means two or more than two organs dysfunction, right? Dysfunction may be liver function test abnormal, maybe the renal function test abnormal, or maybe the the cardiac function like systemic blood pressure, mean arterial pressure decrease, right? So this is what the multiple organ dysfunction, and this should also persist at least for what? 24 hours. Then only we can say what? Multiple organ dysfunction syndrome. But here in severe sepsis or septic shock, may not present for 24 hours, but the criteria should be what? The vasopressor need or vasopressor does not need. These two criteria should be applicable for the severe sepsis or septic shock. But in case of MODS, strictly this organ dysfunction should persist for at least how many hours? 24 hours. Bacteremia means what? The bacteria present in the blood, but the sign and symptoms may not present. Is that okay? This is called what? Bacteremia. So that patient with surgical site infection, they may present with these multiple criterias like SIRS, sepsis, severe sepsis, septic shock, MODS, or bacteremia. SIRS, you understand, among these 5 criteria, at least 2 criteria should be there. Sepsis means SIRS plus infection should be there. Severe sepsis means sepsis plus organ failure should be there, like systemic blood pressure less than 90 mmHg, but that can be maintained with the fluid therapy, right? Time doesn't matter, right? And the septic shock, patient has the severe sepsis, but the blood pressure, mean arterial pressure, to maintain mean arterial pressure more than 65 mmHg, we need the vasopressor support, right? Then we see this is what? Septic shock. MODS, multiple organ dysfunction syndrome, there should be at least 2 organ dysfunction, right? At least 2 organ dysfunction, and that dysfunction should persist for what? More than 24 hours, or at least 24 hours. Maybe liver function test abnormal, renal function test abnormal, maybe the pancreatic functions like the lipase, amylase rise, right? So this condition should be there. Bacteremia means bacteria present within the blood, but they may not show the sign and symptoms. And at last we have some wound grading systems, right? So this can be asked in the exam. Wound grading systems means, like you can see, we use this Southampton system and asepsis system. They will ask you in the exam which of the following system is used for the wound gradings, right? So and then they will give you the option, right? Southampton or asepsis or some other the systems they will mention. You have to choose one. So Southampton system and asepsis system we use for the wound grading, right? So they will help us to see the severity of the wound, right? Southampton system, though this is not important, if you want to remember the title you can remember. In the Southampton, it used the normal healing with bruising, erythema plus other signs of inflammation. Another is the clear and the homoserous discharge. Another one is post discharge, right? So this kind of the criteria Southampton system use. If it is if you are interested, you can see, otherwise it's not important, right, in the exam. And asepsis system, they use like these are the criteria, right? Like the additional treatment, serous discharge, erythema, purulent exudates, separations of the deeper tissues, isolation of bacteria, stay in IPD for more than 14 days, right? So these are the criteria used in the asepsis grading system. So these are not important, just remember the title. Asepsis grading and Southampton grading is used for the wound severity grading. So please remember, for example, this only the titles, right? And the prevention of the SSI, how can we prevent the SSI? We have 3 the classifications we made over here: pre-operative prevention, intraoperative prevention, or post-operative prevention. Pre-operatively, how can we prevent these surgical site infections, right? We can use the prophylaxis. We know already when do we use: at the time of anesthesia induction or 30 minutes before the surgical procedures, right? And we use this as a prophylaxis pre-operatively. Similarly, we can use the sour or saving. Sour, we can advise the patient to take sour at least 1 day before the surgery. And saving, remember, sour 1 day before, Saving immediately before the surgery. Do not save one day before. If we save one day before, there will be some, the scratching. In that scratching, the infection may develop, and that infection may cause the surgical site infection later. So that saving should be done immediately before the surgery. Shower should be done one day before using the soap, right? And then by this we can the prevent the infection. Similarly, what we can do is that, yes, good nutrition supplements, so that the patient's immune system will be stronger. Intraoperatively, what we can do is that, intraoperatively, hand wash, very important, right? About 3 to 5 minutes of surgical hand wash using 4% chlorhexidine. Please remember, chlorhexidine. This is question in the exam. What do we use in the surgical hand wash? Using 4% chlorhexidine for 3 to 5 minutes hand wash. Similarly, intraoperatively, if it is a long surgery, the surgical glove should be changed in 3 hours. Remember, this is question in the exam. The life of surgical glove, if we use the 3 hours is the timing, we have to change the gloves after 3 hours, right? Similarly, we have to maintain the sterilization, asepsis condition, proper asepsis condition, right? We have to maintain this one. These are the intraoperative, uh, the measurement for the prevention of the surgical site infections. Similarly, we have, yes, gloves change, I said, hand wash, I said, right? And yes, this we did already. And then post operatively, yes, we have to give the antibiotics coverage we can give. Similarly, we can do what, the yes, reassess and remove the drain as soon as possible, because drain can be the potential site of the infections. And similarly, right, the glucose control, very important. Glucose control less than 150 mg per dl. This is important question for the exam. So these are the points by which we can prevent the surgical site infections. So hope you understand about the surgical site infections. Now we will meet in another session about the burn. Okay, the burn is also very important topic for your exam, right? So that we will do it about the burn in the next lecture. Thank you very much. Keep preparing for your FMG exam.